know that based on data that was gathered by December 2012, over 1 million patients have been treated using adult stem cells and have significantly improved their health. According to the New York Stem Cell Science website, which was last accessed on July 4th, 2022, potential benefits of stem cell research are numerous and range from development and testing of new drugs to cell-based therapies in which stem cells are used to replace ailing or destroyed tissue or cells. With extensive research and various sources that I have read, I was able to gain knowledge about stem cell research. Stem cell research is crucial for the development of potential treatments for various human diseases. Without the continuation of stem cell research, treatments and cures would have not been as advanced in today's society. Today, we will discuss the problem, the solution to the problem, and the visualization of how the solution will resolve the problem. First, I would like to discuss with you the problem of leukemia and how it affects people. According to the book, The Gale Encyclopedia of Science, Volume 4, Edition 6, by Lawrence Hammer, published in 2021, states that leukemia is a cancer where there is an abnormal growth of blood cells that mainly take place in either the bone marrow or lymphatic tissues. As neither contagious nor infectious, there is not a clear reason as to how leukemia is acquired. However, researchers believe that leukemia can occur due to genetic predispositions. Additionally, current research has pointed to the idea that leukemia is caused by a genetic injury to the deoxyribonucleic acid, or DNA, which would lead to the damaged cell multiplying until it has reached its cancerous state. Apart from that, leukemia starts from the bone marrow. It would then spread through the lymph and blood system to tissues and organs. In some cases, it could even spread to the brain and spinal fluid. Usually, normal leukocytes play a role in attacking, killing, and getting rid of foreign microbes that could potentially harm the body. However, the leukocytes from leukemia patients are completely different. They are abnormally shaped and are increased in number compared to the normal amount. Additionally, they have an immature development and is considered to be called lymphoblasts. When lymphoblasts rapidly grow, it would outnumber the erythrocytes that help transport carbon dioxide and oxygen in opposite directions throughout the body. It could even affect the platelets that have the purpose of clotting up blood. Besides that, to determine the severity of a patient having leukemia, they are identified based on the type of leukemia, as it can be either acute or chronic. There are 4 types of leukemia, which are acute myeloid, chronic myeloid, acute lymphocytic, and chronic lymphocytic, as stated on the American Cancer Society website that was last accessed on July 4th, 2022. Additionally, Hammer stated in the Gale Encyclopedia of Science, Volume 4, Edition 6, that scientists are able to identify the distinction between acute and chronic stages of leukemia based on the number and ratio of lymphoblasts, erythrocytes, and platelets. Due to more advanced technology and greater awareness, more cases of leukemia have been diagnosed. Nonetheless, new and improved therapies have assisted leukemia patients throughout the healing process, which have reduced the number of deaths. Now that I have discussed the issue, let's discuss the solution that can help it. One of the possible cures for leukemia is stem cell therapy. This means that if scientists continue the research and study of stem cells, there will be many benefits that can help out more patients. The Mayo Clinic website that was last updated in 2022 says that a benefit of stem cell research is that it could further the understanding of how diseases occur, as well as how stem cells can generate healthy cells in replacement of cells that were affected by diseases. Researchers and scientists will be able to understand the development of diseases and conditions that occur in the body. In addition, they can observe how stem cells mature in different kinds of cells. Furthermore, on CBS's 60-Minute Spotlight, they interviewed Robert Robbins, a medical doctor, who said that stem cells can be guided to become specific cells to cure diseases and heal injuries, as well as regenerate tissues that have been ravaged by disease. Another benefit is that stem cell research can help scientists test new drugs to use its safety and effectiveness. Stem cells that are programmed into tissue-specific cells can be used to test out different kinds of drugs. Before using investigative drugs on patients, scientists will be able to test them out on stem cells to see its quality, effectiveness, and safety. This would allow better treatment for patients and will be much more potent for better results. Also, the Right Path Pain and Spine Center's website that was last updated in 2021 states that stem cell research will be extremely useful as it provides faster treatment and recovery time for patients. Treatment for patients will be much quicker with the help of stem cells as it allows them to be harvested and extracted from either the bone marrow or fat tissue. Furthermore, stem cell applications can take up to less than half an hour compared to surgeries, which can take hours to complete. Also, stem cell applications are painless when injected in the area that needs to be treated. The recovery time of the patients after being treated with stem cells usually takes up to no time, while surgeries can take several months to heal. Moreover, after the treatment, results will start to show within several weeks. According to the book Stem Cell Research and Science, Background and Issues by Brendan E. Aylesworth that was published in 2009, although the continuation of stem cell research is useful for many reasons, there are some people who could argue that conducting stem cell research could end up destroying embryos. To obtain the stem cells from the embryos, scientists would end up having to destroy it, as stated on the University of Nebraska Medical Center website that was last accessed on July 4th, 2022. This would be considered an unethical thing since it could destroy human life. However, the Right Path Pain and Spine Center's website that was last updated in 2021 states that embryonic stem cells have been banned since 2001, making stem cell research and practice today much more ethically responsible. Also, there are other ways to collect stem cells than just getting them from embryos. On the Medical News Today website, which was accessed on July 4th, 2022, the human body is constantly renewing its tissues. This would allow stem cells to constantly divide, as well as tissues being produced, repaired, and undergoing maintenance. Hence, scientists are able to obtain stem cells in other locations than just embryos, like the brain, bone marrow, blood, and blood vessels, skeletal muscles, the skin, and liver. After discussing the solution to the problem, let's visualize and discuss the impact that it would have on people's lives. Continuing the efforts of stem cell research will be extremely impactful as it can influence the future of medicine. The effects of stem cell research will greatly affect stem cell therapy, allowing a healthier alternative and treatment for patients. Additionally, scientists will gain more knowledge and deeper understanding of the different stem cells and their assistance for curing diseases. This would allow them to find more effective cures that can help patients. Also, stem cell research can result in having patients living happier and healthier lives. Without some kind of research, cure, or treatment, different kinds of cancers and diseases like leukemia would have not been resolved today, and it would have taken a toll on many of the patients' lives. We have completed our discussion regarding the problem, the resolutions to the problem, and the visualization of how our lives would be like with and without the problem. So let's review. We now see the problems of leukemia and how it develops and affects patients. By continuing the progress of stem cell research, scientists will be able to find new potential cures and treatments that can help treat other kinds of cancer and diseases. Also, the continuation of stem cell research and treatments will be life-changing for many people in the future. Stem cell research in death with diseases like leukemia and Parkinson's disease are needed to aid patients who have to undergo stem cell therapy. I am aware of opposing opinions, but just feeling this way won't change anything for the future of medicine. By donating money to foundations relating to stem cell research and diseases, you can help scientists continue their research to help patients live happier and healthier lives. I have learned medical information about stem cells for months in biology class and have read many professional medical journals regarding this aspect. In the future, I can utilize the information and knowledge to help me become a cardiothoracic surgeon where using stem cells is required to help patients. As once said by Nancy Reagan, the former First Lady of the United States, now scientist has presented us with a hope called stem cell research, which may provide our scientists with many answers that have for so long been beyond our grasp. Thank you.